One of the most common dental procedures done every day in dental offices is still being done with 40-year-old technology. Stick around and find out the old way and the new way. Hey guys, how's it going? Dr. Rob Stanton here, cosmetic dentist, Fort Lauderdale, Florida. 25-year clinical practice, adjunct faculty, Nova Dental School, OnlyFans, foot model, although the pedicures are starting to get really ticklish. So I'm here to talk about a procedure that's done every day in general dentist office. Over 30% of Americans have one, and that is a crown, bridge, or veneer. So there are a couple ways to do this. There is the old way and there is the current way. Unfortunately, over 90% of offices are still doing it the old way. Now, what do I mean by that? The old way would be you have a tooth that's either broken or had a root canal or it needs a crown for whatever reason. You go into the office, dentist numbs you up, prepares or gets the tooth ready for the crown. Then he takes that goopy impression with that green or orange or whatever colored stuff that you bite on for like 6 or 7 minutes. Then he makes you an ugly little weird feeling rough temporary crown that you wear for 2 to 4 weeks. Then you come back 2 to 4 weeks later. Hopefully that temporary hasn't come off. He takes it off. If your tooth has not had a root canal, maybe it's super sensitive, he might have to numb you again. Then, whatever crown he got back from the laboratory, we get to see if it fits and hope that it does. And most of the time it does, but sometimes it doesn't. And that's a great day for him. And then he, secures it with adhesive and you're on your way. So that is what I and any high-tech dentist will call the old way. Why? Because the current way is by using digital technology. So basically, the first 2 steps are the same. So you still have to numb the tooth. You still have to get it ready to receive a crown. Everything else after that is different. So we basically use a digital scanner. Then we use digital software to design it. We use a little CNC mill to create it out of a material that is far superior to the laboratory material. And then about 30 minutes after we started, we have a completed crown ready and we can put it in the patient's mouth. They're good to go. No need for a temporary, no need for a second appointment, no need for a second shot. Those all sound like conveniences, and they are, but clinically, we have something that fits better, looks better, is stronger, and will last longer because of those factors. So we're just gonna walk through a quick crown today, and you get to see how it's done, and you'll understand why this method is far superior to the analog method. Be right back. Okay, so we're gonna demo the optical impression using the scanner. We're doing 2 implant crowns on the upper left right now. So we're just gonna take a quick little scan over for me. I'm gonna do this without an assistant to show you how easy it is. And also because my assistant has a really big head, so she would have blocked the shot. And instead of a goopy impression that takes 10 minutes, we have this, and it's done. So that was the top. And now we just gotta do the bottom. Stay open for me. And that is how extremely difficult it is to do that. And then we get the bite. Close all the way down. Stay closed nice and tight. Do not shift, don't move. The computer stitches everything together. I got a green check mark because I'm a good boy. And that's it. So it's super accurate, super easy, and now we're gonna move on to the design stage. Okay, so now we're at the next stage. That's our optical impression right there. And we're gonna go ahead and get a design going. So the computer's gonna give me an initial design, and then I'm gonna use all of my smarts and experience so that's the initial design. So we gotta make a couple changes here, but pretty good start. And you can sort of see these would technically work, but we're gonna definitely perfect them. All right, so our design is done. Now we're ready to mill these out. That took just a couple of minutes. So there's what one of them looks like. And we are going to send this to the milling unit, and it'll be done in about 10, 12 minutes. Okay, this is our milling room. Well, this is our digital lab. We have some 3D printers in here also. So these are the milling units. This one is ready to make that crown for us. So we just pop in the block right here, and we're going to lock it in place like this. And now it is ready to go. We hit start and watch the magic. So this is the material that the crown is made of. Yes, I know it's purple. Patient wanted a purple tooth. No, it's not going to stay purple. And this is the machine that is going to make it. So we are going to pop this in right here like this. And then we lock it into place like this. And close the door, hit start, and off she goes. It's as easy as that. I kind of feel like this is one of those cooking shows, you know, where they just like throw the stuff in the oven and they say cook on 350 for 20 minutes and then magically like 30 seconds later they pull out the finished one. I should make you guys watch all the boring stuff it takes to actually make this. But no, it's gonna take about 10 minutes in the milling unit and then I'll show you the next step. But it's about 10 minutes to get this part out. Okay guys, so 10 minutes is up. We got our crown out of the milling unit and this is what it looks like. So I actually could take this right now and I could just polish it by hand and put it in the patient's mouth, and sadly it would look better than probably 75% of lab-made crowns. But we don't do that. We customize it so that it looks really natural. And I'm gonna show you how we do that right now. So editing guy, you can go ahead and speed up this next part because otherwise it's gonna be kind of boring. All right, so I don't know how long that seemed to you, probably 5 seconds, but that really only took about a minute. And all I did was I took some color and I characterized that so that it has some transition and it looks like a natural tooth. So this is actually porcelain that has color in it. And if you know what you're trying to match, you can always get exactly what you want because the patient is sitting 6 feet away from you. So it's one of the many conveniences of using this method. So now what we're gonna do is we're just going to take this and we're gonna put it in our little vacuum furnace. That's it, opening sesame right there. And we pop it in and we hit start and 12 minutes. Buns in the oven. All right, our cookies are done. So we just gotta take them out of the heat. Notice no more purple. So they are ready to go. We're just gonna let them cool down and we will come back and get them ready to deliver. All right, first off, ignore my fingernails. They are disgusting, I understand that. It is the only bad habit I have, so I've tried to quit and I can't. Anyway, besides that, this is the finished crown. As you can see, it is nice and glossy. It's got color transition from the bottom to the middle to the top. It looks like I literally pulled this tooth out of somebody's mouth and now I'm playing with it like some kind of creepy weirdo. But it is not a tooth, it is the crown that you saw me make. And from the time the patient sits in the chair and you numb them up to right now is about 1 hour. So that's how fast and simple and convenient and easy it can be to get a really good product that fits really well, perfect bite, perfect everything. And this is the way that you should be getting your crowns. So you'll be seeing more of this technology in the future, but I hope you enjoyed getting this brief example of it. All right, guys, so that was a quick demo of how a crown is scanned and created and finished off and delivered. So hopefully now you have an idea of the vast difference between doing it the old way and the new way. So if you're still using a fax machine, then great, do your crowns with a lab. But if you'd like the best possible product with the most possible convenience and the longest lifespan, then seek out a dentist who has training in digital crowns. Your mouth will thank you for it. See you next time.